Good afternoon, folks. Robert Chappell here, Executive Editor, Madison365, with your daily update for Wednesday, July 27th. Hope you're having a good one. It's beautiful outside. I hope you're able to get outside and enjoy that. We're going to talk through some COVID numbers, which are not looking that good, I'll be honest with you, as well as some massive, massive news in the race for the United States Senate and some other really great local things that we want to talk about. But first, let's get this bad news out of the way. The 7-day average of new COVID cases confirmed in the state of Wisconsin is now at 1,800. That was 1,600 just a few days ago. Not great. The positive test rate is at 14.8%. It's getting much higher than we'd like it to be. I mean, you want it to be, in the spring, after the big Omicron surge in the spring, we got it down to 3%. And now it's back to almost 15, which is not great at all. The 1,800 7-day average of new cases includes 2,316 cases just today. That's the highest single day count we've seen in quite a while. Hospitalization is also up, not quite as sharply. I'm very concerned about the ICU population. We're looking at 491 people currently hospitalized, approaching 500. That's up by 8 in the last day, but that's 36, an increase of 36, a little more than 5% in the past week. More concerning, though, remember yesterday, in the ICU population jumped by almost 50% in one day. And I thought maybe it was a kind of a counting anomaly. It just kind of depends on what time of day hospitals report their populations and if people are waiting to be discharged but haven't been discharged yet, or that kind of thing. Sometimes there can be a big jump, which then goes away the next day. Unfortunately, that's not the case. 87 people currently hospitalized in the intensive care unit. That's 10 more than yesterday, which was 23 more than the day before that. So we're still doing okay in terms of hospital capacity, right? We have 139 ICU beds currently available in the state of Wisconsin, 77 intermediate care beds, medical surgical beds, 357, and then 480 negative flow isolation rooms, which are the rooms that people are put in when they're highly contagious. Those are all relatively normal ranges of rooms, but it's not just the rooms available, it's the staffing too, which continues to be a challenge. So all those are not great. The 7-day average of fatalities, however, remains relatively low at 3. It was 2 yesterday, so it got up a little bit, but I don't expect that to rise considerably for at least a couple of more weeks. And then we'll see what this current surge of cases will do to the fatality rate, 3 or 4 weeks from now. Given the way things have gone since Omicron, the case fatality rate is well below 1%. So I don't expect that to get into double digits, but we'll have to wait and see. We'll have to wait and see what BA5 does, which is what the variant that's hitting us right now. There are currently, looks like about 15 counties in the state of Wisconsin that are in the high community spread range, which means the CDC would recommend masking indoors. Door County, Brown County, Portage, Eau Claire, Rusk, Sawyer, and Barron counties, Grant, Richland, Iowa counties, and then South Central Wisconsin, Columbia, Dane, Greene, and Rock counties, and then down in the southeast portion of the state, Milwaukee and Kenosha counties, all in that high range, all recommended masking indoors. Nothing's mandated, but the CDC recommends masking if you're in that range. Almost the entire rest of the state is yellow, which means medium, which is, I guess, fine. But then there's a handful of counties that are still green in the low range, which is, good. We're still relatively low in terms of vaccinations. We're still at about 35.1% fully vaxxed and boosted. 64.6% have gotten one dose. 61.5% have completed the series. I hoped that those would start to rise once the childhood vaccines were approved, and we haven't seen a big spike there yet. So that's the news. Mostly bad news, I'm afraid, but if we can, we're going to take a pause. We're going to hear from our sponsor, Madison College, and we'll be back with some massive election news and some other local news right after this.
They say home is where the heart is. But who is this they? And can they deal with my life on a day-to-day? I work for the come up. Every day there's a war. And as I look at my circumstances, I know that there has to be more.
I pass by the haters, all those acting sus.
I keeping on because making it is a must.
I do this for the block. I put on for my community.
They give me the drive to push to where I need to be.
Understand I am built for this. I stand tall, no matter life's twist.
But now it's gotta be more than just me seeing this through.
It's gotta be me, and it's gotta be you.
No one knows what the future holds, so I treat it like a present.
I'm just saying, I can be a little more bold when I don't have to worry about groceries, childcare, or rent.
I've been a face in the crowd, a nameless number under the sun.
But all of that changes now, because I'll meet you one-on-one.
See, learning and growing is making things clear. I've got to pop now. It's gotta be right here.
Here, where I'm seen, where I write my destiny. Here, where I can be every version of me.
Past, present, and future. I'm not in it alone.
If you're willing, I'm ready. So let's bring this thing home.
Thank you to Madison College for their continued support of nonprofit local community media. Going into some news, some big news from the state today. We told you on Monday, Tom Nelson, who had been lingering in fourth place, dropped out of the race for the United States Senate, endorsed Mandela Barnes, and made basically a two-person race between Mandela Barnes and Alex Lasry. Well, today, stunning news that Alex Lasry has also dropped out of the race and also endorsed Mandela Barnes. He cited, we've got some reporting from CNN on the site. He cited internal polling that showed Barnes at 35% and Lasry at less than 30, like 23, 24%, which it was not, he didn't feel like he was going to be able to overcome that. So after spending $12 million of his own money on this campaign, he's dropped out 2 weeks before it's over. He said in an announcement outside Pfizer Forum in Milwaukee that Mandela Barnes won the race, which a little strange way to say that, considering, the vote hasn't actually happened yet. A lot of people have early voted already. Nelson and Lasry will be on the ballot, but neither of them is actively running. Both have suspended their campaigns and thrown their endorsements to Barnes, which for all practical purposes seals the deal for Mandela Barnes. Sarah Godlewski and a handful of other lesser known candidates are still technically running. Godlewski is lingering around 12% of the vote or less, depending on the poll you look at, and has said she will remain in the race. So what that basically does, August 9th is the primary, but it sets up a showdown between incumbent Senator Ron Johnson and Lieutenant Governor Mandela Barnes for the general election in November, at which time Barnes will seek to become the first person of color, the first Black person to represent Wisconsin in the United States Senate. Also today, Marlene Gongora, our health reporter, has a story on a new project with the Alzheimer's Disease Research Center, the Wisconsin Alzheimer's Disease Research Center, and the United Nations. They've got a grant from the National Institute on Aging to create a culturally appropriate dementia screening toolkit. There are massive disparities in dementia and Alzheimer's disease among indigenous communities, and the this grant will allow the center to not only study those disparities and try to figure out why those disparities exist, but also just help those communities screen better. There's obviously a well-earned mistrust between those folks and the white establishment medical community, right, which leads to part of the disparities. But there's a lot more to it than that, and it's also, we spent so much time trying to erase their cultures that some of these elders and their memories are really, really important. So to stave off dementia, to screen it, to identify it early, really, really important. Marlene was on the It's Only 10 Minutes podcast. If you're interested in this topic, go back and listen to this morning's It's Only 10 Minutes podcast. And Marlene has a lot more on the story. And the story is on Madison365.org right now. And and finally today, another podcast recommendation for you. If you missed the Men's Leadership Summit back in June, we're dropping all of the sessions as audio podcasts. These are fantastic conversations. This one on reimagining Black and Brown Brotherhood. It got really real, you guys. Really, and we appreciate all those men and their candor and their vulnerability on that really sensitive topic. And that is in the Real Talk with Henry Sanders feed. Wherever you get your podcasts, just search for Real Talk with Henry Sanders, and it'll be there. That's all I have for you today. Have a wonderful evening. We'll have more updates for you tomorrow morning on the It's Only 10 Minutes podcast, as well as on Madison365.org. As always, follow us on Facebook, Twitter, Instagram, LinkedIn, wherever you look for news. We'll try to be there. Have a wonderful evening. Take care of yourselves, and we'll talk to you soon.
This is 365 Media.